Welcome to topic 4 of managing human resource for health. In this session, we are going to focus on legislations of human resource in healthcare sector. So by the end of this presentation, I expect you to define and explain the key regulatory bodies and frameworks governing human resources in the healthcare sector, identify the major laws and regulations that impact the management of human resources in healthcare organizations, outline the process of ensuring compliance with the health sector regulations related to human resources, and finally, develop skills to interpret and apply relevant laws and the regulations to daily human resource practices within the healthcare setting. So, having looked at the learning outcome, now let us look at the international labor law, which is actually the center of every country's labor law. A global framework for protecting workers' rights and promoting decent work. So when we talk of the workers' rights in this context, we are referring to the right of the doctors, we are referring to the right of the midwives, the nurses, the lab technicians, and other health-related professions or employees. So it was established by the international labor organizations to cater for the welfare of the employees in an organization, and it has a lot of conventions, recommendations, and the declarations. So that's about the labor law. So all the countries in the world uh, adopt the labor law to make sure that they implement it in their respective working environment or organizations. So that's about the international labor law. So let us look at now the ILO, or the International Labor Organization. So the International Labour Organization was established in 1919, that is after the First World War or the World War One. It is a specialized agent of the United Nations, which is headquartered in Geneva, that is in Switzerland. So its fundamental mission is to promote social justice and fair labor practices global. Like what I've told you before, that all the countries in the world, they just adopted the international labor law, which was developed by the International Labor Organization. Even for us in the South Sudan context, with our South Sudan Labor Act, that is 2017, I expect you to read that to know what is in that article concerning the regulations of employment or labor issues in the country. So it has an element of international labor law. So that's about the International Labor Organization, which is responsible for work or employment issues at a global level. So having looked at the International Labour Organization, now we are going to look at the National Labour Laws. So we just talked about the South Sudan Labour Act of 2017. So each country has its own labor laws that build upon the complement international standards. These laws typically address employment contracts. We have the working hours, leave, wage, and benefits. So on top of the labor law, these are some of the key aspects you will find even in our own South Sudan Labor Act of 2017. These are some of the provisions you will find there. So according to South Sudan labor law, we are supposed to be working for about 8 hours in a day. That is starting from 8 at South Sudan time to 4. Okay, so that's the labor law of South Sudan. In some countries, it also differs because of the context, the nature, and the etc. of the economy they do have and the other political environments. Then the national laws may vary in their scope and level of detail depending on the country's unique socio-economic and cultural context. This is what I've been just explaining. So in our context, we need to focus more on South Sudan Labor Act of 2017. So having looked at that, now let us focus on the labor unions and the associations. So organizations representing the interest of workers, that's if you talk about labor unions. So in South Sudan, you have the teachers union, you have the doctors union, etc. So their work is basically to represent the interest of their members, of the workers. So the nurses, the doctors, the midwives, they are supposed to be joining such kind of unions. And the labor law, the international labor law actually allows that. There's no way the hospital, the organization can resist the employees, the doctors from joining any union or association. It's actually their right. Even in the labor law of South Sudan, that provision is there. So play a vital role in promoting fair labor practices and improving working conditions such as wage benefits, working hours, etc. So that's about the labor unions and the association. So it's very important for you as an individual employee to make sure that you join such kind of unions because they help a lot in terms of settling employment related issues. If it's about maybe low wage or limit in payment and fair working condition, etc. And for you, the managers, the administrators of the hospital, you also need to make sure that you are familiar with some of these associations and unions. They help you a lot in terms of interpreting some of the laws regulating, concerning employment. So that's about the labor unions and the association. The next thing we're going to look now at is the function of labor unions and association. Number one is collective bargaining. So in terms of collective bargaining, we are talking about the negotiation with the employers. Okay, it could be on wage or benefit or working conditions and other terms of employment. So here, the individual doctors, the individual nurses, they don't negotiate with the employers. So just from the word itself, collective bargaining, it means the union can represent the individual doctors, excuse me, the union can represent the individual nurses to negotiate on their behalf with the employers if it's all about improvement of working conditions or if it's all about increment in wage or salary, etc. So that's the function of the association of the union. So if you go there alone, the chances are high that the organization might not pay attention to you. But if the association or the union comes and negotiates with them, chances are high that your complaints will be heard and addressed. The next function is the advocacy and lobbying. Okay, they advocate for fair or conducive working environment through the government agencies or legislation. Okay, they can go to the parliament, table their bill. The parliament can work on that, and then executives can approve it. So that is how they advocate for the welfare of doctors, the nurses, of course, other employees. I'm not only talking about the doctors, but that is our focus. This is also applicable to other professions. The next function is representation. They provide legal and other representation to workers in dispute with the employers. So if there is any dispute or disagreement between the organization and the employees, they will come in and they represent the employees in courts of law. So instead of you, the doctor, the nurses, or any other employee of the organization going to the court to settle the dispute, the labor union or the association can actually go there and represent you. Then lastly, under the function of the labor union, we have organizing and mobilizing workers. Okay, they make sure that they build a membership, people enjoying the situation, so that issues to do with the strikes, issues to do with the protest is either solved or they can even spearhead it if the condition is not improving. Okay, if the working condition is not improving, there's a harsh terms of pay, of employment, the union can mobilize employees, individual employees to protest. Okay, instead of you going alone on the street to protest, the union can do that by mobilizing people from different organizations to protest against such harsh employment conditions. So these are some of the functions of labor union and association as far as healthcare sector is concerned. Now, having looked at the function, let us look at the benefit of the labor union. Number one is improved wage and the benefits. Okay? If the problem has been low wage, You have been trying as an individual to convince the hospital or the organization to improve on the wage. But when the union comes in, because they have an element of legality authority, when they come in, chances are high that the organization can listen to them and improve on your wage. So as an individual, you are going to be receiving higher or better wage compared to what you had been receiving before. So that's the advantage of joining labor unions or associations. So I'm encouraging you to make sure that you enjoy such kind of association. The next one is enhanced job security. Okay, so if you have union by your side, it means that chances are high that you're going to be in the employment for some good time. Your contract will not be terminated. You are sure of working for more than 5, 6 years, depending on the terms of your contract. So you are not going to be afraid that the organization might end up terminating your contract before its expiration date. So that is how they enhance job security. You are sure of working for good time with the organization. The next one is safe working conditions. After advocating for your right, remember in the previous slide we talked about representation in the courts of law, things like that. So after representing you, after advocating for the safety of the workers in an organization, maybe through the government agencies, of course what happens is the government is going to set the policies or improve on the policies which will actually favor the working condition for the employees. That's number one. Then number two is even the organization themselves, they will work to make sure that the working condition, the working environment is actually improved after the interference of the unions. The last one now is greater voice and the representation. We are just repeating what you have already said. So they can represent you, they can act as your voice, they can act as your spokesperson, or what you can call agent etc. To make sure that they talk on your behalf. Your problem, they will present it to the concerned authority so that action can be taken to address such problems. So that is how we benefit from joining labor unions or associations, whatever profession you are in. So having looked at the benefit, now let us look at the ethical standards in healthcare, human resource management. We have some standards of ethics to be followed in healthcare. Number one is fairness and non-discrimination. So you need to treat doctors equally regardless of their political affiliation, regardless of their gender, regardless of their background, etc. So it means that when it comes to the requirements of the job, it's about academic qualification, consider that, don't consider the political affiliation. That's what we call discrimination. So when it comes to also payment or compensation, they should be compensated based on their qualification, based on the task they are doing. So do not discriminate your doctors, your nurses, because others come from the region which you don't like, or others are from a gender which you think they are the minority. I'm talking about the female doctors. That's not right. So it is an ethical practice if you do that. The next one is transparency and accountability. As an admin or as a human resource manager in the hospital setting, you need to be very transparent in terms of managing recruitment. You need to be very transparent in terms of remuneration or compensation of the workers. I'm talking about the doctors and other staff in the hospital. You need to be very transparent. And also you need to be accountable for whatever decision, for whatever message, for whatever everything you're doing in the organization. You must account for that. You should be able to account for it whenever time for auditing comes in. So that is about ethical standards to be followed by the administrators of the hospitals or healthcare organizations. So we still continue with the ethical standards in healthcare. The third one is confidentiality and data privacy. So this applies to both the doctors or the employees and the organization itself. So the record, the information of the doctors, the nurses, the midwives should be kept confidential. It should not be uncovered to the public or even within the organization. That's one. Then for the doctors, you need to make sure that the information or the medical records of the patients are also kept confidential. So that's part of ethics. If you reveal someone's health status, you are causing more harm to that person than the disease itself. So it has also legal implications. So therefore, make sure that you keep all the medical information confidential as a doctor, as a midwife, nurse. Then as admin, you also need to keep the information of your employees confidential. And if you have access to some of the information of the patients, please make sure that you keep them secret. The next one is respect and dignity. Okay, so you need to treat all employees equally, regardless of their age, regardless of their academic qualifications, regardless of their status in the hospital. Treat them equally and with the respect. This thing of not respecting the lower level employees is actually an ethical practice, and that's what you call harassment. Such employee can actually take you to court, and then the organization will suffer in terms of compensating him, or in terms of paying some fines to the to the court. So these are some of the ethical standards issues you need to know as the human resource managers in the medical setting. So having looked at that, now let us look at the ethical recruitment and selection. So recruitment has to be transparent and unbiased. So we are talking about the job posting. If you're advertising for a position of a clinical officer, it has to be in a transparent way. You have to make sure that you post it either in the NGO forum. This is what people are doing nowadays. You take the advert there to be posted so that millions of people can view it. You can take it to the public notice board whereby you can post there the job, and then start receiving the application for such opportunities. That's what you call transparent. Otherwise, do not only hide it and then give it to the people you feel they should be the one to be recruited. That's not being transparent, and that's also being biased. You are already biased. The recruitment exercise will not be transparent if you do that. The next one is a fair and valid assessment. We are talking now about the interview process. Okay, you've posted the position, people are now applying. So instead of using the same standard or uniform assessment method, but you decide to alter it. Okay, the person you are favoring, you give them the simplest questions. So the person you're trying to eliminate, you give that person very difficult question to answer during the interview process. So that is not right. It's unethical. As human resource officers or as human resource managers in the hospital, you really need to desist from that. Make sure that whoever has been shortlisted based on the experience, based on the academic qualifications and other requirements, please, they have to do the same interview at the same time, the same place. The next one is equal opportunity for all qualified candidates. Okay, if you have people whom you think are eligible for the interview, depending on the policy, if you are going to select 10 candidates for that interview, please make sure that you give all opportunity to them. And if you are going to use the internal method of recruitment, whereby you are promoting maybe individual within the organization, you also need to have the equal opportunity. Being a lady, being a man, whatever. So you need to make sure that you are going to be fair. Then the last one is avoid discrimination and harassment. Discrimination can be in terms of knowing whom to go with, whom not to go with. That's discrimination, favoring a particular group of people than others. Then harassment can be harsh treatment of the people who have applied for the job in terms of shouting at someone in case the question you have asked is not well answered, etc. That's how you harass people. The harassment cannot just be during the interview. It could also be after giving the job to the doctor or to the midwife or the nurses. You can be harassing such person sexually, what you can call sexual harassment, etc. So these are some of the elements of ethical or unethical practices within the recruitment process. So you need to make sure that you desist from such unethical practices. Having looked at that, let us look at the categories of fraud now in the human resource management within healthcare. The fraud we're talking about is the time and attendance fraud. Okay, this is about representing someone. Okay, that is not good. You're expecting to meet Mr. John, but Mr. James comes in and then pretends to be Mr. John. Okay, that is very bad. So it is a fraud in healthcare. For example, you doctor who's supposed to be diagnosing or treating a special person. The person knows you are someone who's going to work on him or her. But another doctor comes in and pretends to be the first doctor. That's his fault. Okay? And he's highly condemned. So here they're saying that clocking in or out someone else, falsifying time sheets, working unauthorized overtime, etc. These are some of the time and attendance fraud. Okay? You have worked for only 3 hours, but in the time sheet you've put that I've worked for 4 hours or 5 hours. Time what? Fraud. Okay? You need to exactly indicate the time you worked for. If it is 3 hours, let it be 3 hours. Don't pretend. The next one is payroll and benefits fraud. Okay, this is when we pay ghost workers. The ghost workers, these are people who are on the pay list, but they are not actually working. Okay, they are not practically existing in the organization, but the money goes to the individual account, especially the people who are administering the payroll. Could be the human resource, could be the accountant, finance, etc. So they're the one who know that where the money goes. But otherwise, as a human resource, make sure that you don't have such kind of people, what you call the ghost employees in an organization. Or it could be in terms of duplicate payments. Okay, someone you pay someone twice. That's about fraud. Okay, then we have unauthorized benefits claim. You know that you are not deserving the benefit, but still you claim for it. Okay, or the person who is processing the benefit can authorize it, yet your bosses have not authorized or approved it. That is a fraud in healthcare management within hospital and some of the organizations. Make sure that you don't involve yourself in such kind of fraud. The next one is recruitment and selection fraud. Okay, this is about falsification of credentials. When you talk of credentials, I'm talking about the papers, okay, academic documents. You come in with the fake academic papers because you want to get the job. So as the human resource managers, the administrators, you need to be very careful when you are doing the recruitment. Because people are coming with the fake documents. How do you know that this is a fake document? So you need to be very careful with the interview process. The interview has to be professional. However, we also have some people who are professionals. They know almost everything within the healthcare, but they're having fake papers. You should be able to detect the fake papers from the original one. Okay. Others, they provide false information on applications. Okay. Writing different name. Also, you pay for job placements. Okay. You are the human resource manager, you accept bribes because you want to recruit someone. Maybe the person says, I will give you 30% or 50% of my first 3 months salary. You recruit me. So these are some of the fraud in recruitment selection we're talking about. So as a human resource managers, you need to avoid that. It is a crime. I want to repeat this, it is a crime. Don't involve yourself in this. Time will come for auditing. When the time comes, you will be caught. And what happens if you're caught? Your career is gone. No organization will ever employ you because of fraud. So these are some of the fraud in healthcare management. After looking at that, now let's look at how are we going to prevent the fraud in healthcare. One is you need to implement a strong internal controls. Okay. As admin, you need to make sure that you have a system in place to detect fraud. Okay. There should be procedures to follow. If someone is claiming for benefit, there should be what? Procedures to follow. Okay. You need to have clear statistical numbers of the employees you're having in the organization with the IDs. This will help to address the issue of ghost workers. Okay. The next one is you need to conduct thorough background checks. As this one comes back to the human resource during the recruitment process. There's all what we call background check or the reference check. Do it thoroughly. During the process, you will identify that this person actually is a fraudster, is lying. The person has said that they have been working with the UN for 5 years, this year to this. But if you check, you may find that the person is not even in the record of the UN. Okay, that's the fraud. Then you need to verify employee information and qualifications. Where did this person study from? Which program? These are some of the things you need to look at before you think of considering the employees. Okay. Because someone can say that I studied from University of Juba because it's considered to be the headquarters of the academics. I studied from University of Juba. Kumbe, this person studied from nowhere. You should be able to verify whether this person truly studied from University of Juba. Okay. Then encouraging ethical reporting of suspected fraud. If you detected any element of fraud, please you need to report it to the concerned people. That is how you prevent or minimize fraud in healthcare. So it's not only in healthcare; it applies even to other organizations which are not dealing in health section. So having looked at that, let us now look at the reporting fraud in healthcare management. How do we report the crime? Fraud is actually a crime. Okay? So you need to establish a clear reporting procedures. Okay? How do you start reporting any suspect of fraud? Okay? Who is the first person to be reported to? Okay? That's very important. Number two is maintaining anonymity and confidentiality. So the person who is bringing to you the suspect or the issue of fraud, his identity has to be hidden. That's what we are talking about. You have to hide his identity or her identity. This will encourage her to be even more safe in the first place, and also to trust you, and will bring more information to you concerning the issue in question. Then investigating all allegations thoroughly. So whenever allegation has been brought into the discussion, please make sure that you investigate it. Okay. So there's a saying that there is no smoke without fire. So whenever you see smoke, there must be fire somewhere. So any allegation has to be thoroughly investigated. So taking appropriate disciplinary action. Okay. If you have identified that the finance is paying ghost workers, there must be disciplinary action taken against the finance. Seriously. Okay. If you find out that one of your doctors or the nurses is having a fake document, however much he's performing well but is having a fake document, there should be what? Disciplinary action taken against such a doctor. By doing that, you are going to minimize the rate of fraud in your organization, and also to make sure that you have a good reputation in the community. Then, now, having looked at that, let us focus on the medical negligence. The medical negligence. So it's basically a failure of a medical professional, talking about the doctor to provide care meeting the exceed standard. Okay. So it's about deviation from accepted practice and the procedures, and then lastly, it leads to harm to patient physically or psychologically. So when talk of the negligence, is basically about ignoring the right procedures to follow. You see, medical is very sensitive. The moment you ignore one protocol, one procedure, one step, the patient's life is in danger. The small sickness will become a big one, then the patient will end up losing his or her life. So it's very important that you don't neglect anything, whether it is the first step, that is about consultation with the doctor, it has to be there. That is the protocol. Do not bring the patient and start operating, doing surgery without first consulting the doctor. Maybe the issue does not require actual surgery. So that's about the medical negligence. So let us look at examples of a medical negligence. One is misdiagnosis. It's all about failing to diagnose a medical condition. The person has been brought to the facility, but you don't know exactly what is his or her problem. It could be malaria, but for you are saying there's no malaria, it is maybe just the malaria. Yet the person is suffering from malaria. There's no typhoid, you're saying there's typhoid. That's what you call misdiagnosis. And then they are going to give that person the medicine for treatment, yet the disease is not there. And that medicine is also going to cause a lot of harm to the patients. Okay. Then delayed diagnosis. That's another negligence. The person has been visiting you, but you are not doing the needful. The person comes today, you are delaying, come tomorrow. The person will end up dying, the patient will end up dying. So do not delay any diagnosis. Whenever the patients are brought to the facility, please make sure that you attend to the patients. Then treatment errors, that's another area of negligence. Okay? Performing an incorrect or unnecessary procedure, that is an error. Okay? The person has been diagnosed with the typhoid. Instead of treating that person with the medicine of typhoid, you're giving the person quinine, okay? The medicine for malaria. That is mistreatment. And it's going to affect the patient, and the patient may end up even losing his or her life because of giving wrong treatment to him or her. The next one is medication errors. So you have to, here you prescribe the wrong medication or dosage. Okay? The patient is supposed to take uh, two doses, okay, maybe one times two, but for you, you are over this prescribing it. Okay, two tablets, you are saying four tablets. Maybe instead of three tablets, you are under prescribing the dose. Maybe you take one. So these are some of the challenges of having medical negligence in place. So it affects the health of the patients. Then failure to monitor. Okay. As a doctor, you're supposed to be monitoring the patient's condition all the time, in the morning, in the afternoon, in the evening. But some doctors, whenever they're done with prescribing the medicine, they don't even see the patients. They leave everything in the hands of the midwives, the nurses to take care of. But that's not right. That's what you call negligence. So as a doctor, you need to make sure that you monitor your patient from the day he or she was brought to the facility until the recovery period. So that is how we can give explanation of medical negligence with the examples. So having looked at that, let us now focus on the consequences of medical negligence. Number one is, of course, physical and psychological harm to the patients. The patient is going to be affected physically. That is when the medicine is going to cause harm on him. Then psychological is his mental state is already disturbed, so he or she will not be settling well. Remember, there is a big correlation between the state of mind and then the medication the person is taking. If the state of mind is not in the right hand, then the treatment will take long to happen, or even it might not happen. The person might not recover because the mind is not stable. Then loss of trust in the healthcare system. The person will be not trusting the doctors, everything the organization is doing. Financial impact on the healthcare providers. I'm invested because my power is almost going off. This happens when the patient is having more complications because of the negligences of the doctors. It means the organization is going to pay a lot of money. Then potential for disciplinary action and the reputational damage. The reputation of such doctor is going to be spoiled, and also the organization itself is going to lose a very good reputation in the community. The moment you look at the organization and say, this organization, they mistreated this patient, the patients died, and everything about the organization will be negative. So these are some of the consequences of medical negligences. As individual doctors and administrators, you need to be aware of and make sure that you don't encourage them, because it will damage the reputation of your organization, the reputation of you as a manager, etc. So with that, we have come to the end of this presentation. We link up in the next session. Thank you.